Okay, we shall discuss about dying declaration and dying deposition. So, first, what is dying declaration? It is either a written or an oral statement that is made by a person who knows that they're going to die. Probably they're in such critical condition and they make statements about what that person believes is the cause or circumstances of his death. So, for example, he was in an argument prior to death and, he got stabbed by a person and he's in critical condition and brought to the hospital. So, the statement that he makes is called a dying declaration. Now, there are 10 procedures and features of dying declaration which we will look into. First is the role of a doctor. Now, of course, we know that the role of a doctor is to record the dying declaration because they will be treating the patient. So, they will be in a position to record what the patient is saying, right? But most importantly, the doctor's role is to certify compos mentis. Now, what is compos mentis? It means that the person or the patient is conscious and their mental faculties are normal. Okay, so which means it's not that they were delirious and unable to carry out normal thought processes. Okay, you need to make sure that the patient is conscious and his mental faculties are normal. That is called compos mentis. Okay, next, so when a patient starts speaking, you do not administer an oath. Why? Because you believe that a dying person tells the truth. And you just let the person talk. So, no leading questions are to be asked. Now, third, uh, either a doctor or a police officer can record this dying declaration in the presence of two witnesses. But if a magistrate is present, like you have to call for the magistrate, and if the presence of a magistrate, it holds more credibility and strength. So when the patient is talking, he would be speaking in his vernacular language. You're supposed to note it down exactly how he says it in simple narrative. You're not supposed to translate or write your own interpretation of what he said. Okay. And then say when he is speaking mid sentence, he falls unconscious. So whatever the patient was able to tell until that point, you record as much info as possible and sign by the person who was recording it. So it could be the doctor, the police officer, or the magistrate in presence of two witnesses. And finally, again, you certify the fitness of the declarant that the patient was in compos mentis. And then finally, you seal it and you send it to the magistrate. Now, if the declarant survives, he is called to the court to give oral evidence, and it can be used to either corroborate or to agree with or contradict his statement in court. Okay, dying declaration is not admissible in court if the patient survives after making dying declaration, because then it can't be called dying anymore. He is still alive. And second, the patient was not in compos mentis, which means if the patient was not conscious or his mental faculties were not normal, the dying declaration will not be admissible in court. Now, coming to dying deposition, the magistrate will record the evidence after administering oath in the presence of the accused and his lawyer. There's actually no provision for dying deposition in the BSA, so it is not followed in India, but still. So dying deposition is always recorded by a magistrate, whereas in dying declaration, it could be recorded by either a doctor, a police officer, or a magistrate in presence of two witnesses. Oath is not required in dying declaration because we believe that a person who is dying will tell the truth. But in dying deposition, you need to take an oath or a solemn affirmation. Okay, the accused and his counsel is not present in dying declaration, but in dying deposition, it is in the presence of the accused and the lawyer. Cross examination is not done in dying declaration. You cannot ask legal leading questions as well, but in dying deposition, there is scope for cross examination. And legal value of dying declaration is comparatively less than dying deposition, because dying deposition, the accused is also there, the lawyer is also there, right? So it holds more value. Plus, the magistrate is also present. Admissibility if the declarant survive. Um, in dying declaration, it is not admitted, but it has corroborative value. And dying deposition is fully admitted. So, nature dying declaration is just merely recording the statement of the person before he dies, but dying deposition is more like a complete court procedure. That's why you have the accused, the counsel, like the lawyer, the magistrate, and everyone. And that's why you administer oath as well. Now, the type of evidence for dying declaration is documentary, whereas in dying deposition, it is oral. And the role of the doctor, most importantly in dying declaration, is to assess the compos mentis and certify, and to record the statement in presence or absence of magistrate. Whereas in dying deposition, again, here also to assess the compos mentis, and the statement is always recorded by the magistrate. So dying declaration is followed in India, but dying deposition is not followed in India.